Senator Cruz is back with us. Senator, I'm beyond disgusted at this point with many of your fellow senators.
Well, Sean, good afternoon. It's good to be with you. I understand that frustration and share it. I know people across the country are fed up that we have given Republicans a unique and historic opportunity, control of the White House, of every executive branch, and both houses of Congress. And we need to get our act together and deliver. And when I'm home in Texas, I hear that over and over again. Why can't you guys actually just do what you said you would do? That's my most consistent message to my colleagues is let's deliver. I think the big four that we have on our plate are repealing Obamacare, which is an absolute train wreck, major tax cuts and tax reform, fundamental regulatory reform, and confirming strong constitutionalists to the courts. If we do those four, this could be the most productive Congress in history. But right now, other than Neil Gorsuch, we're not getting any of them done. And we've got to fix that. We've got to step up to the plate and do our job.
You know, the president ran on 7 brackets to 3. He ran on a middle-class cut. He ran on a 15% corporate rate from the highest in the industrialized world to the lowest. He ran on repatriation at a very low rate, the trillions multinationals park overseas because they don't want to bring it here because it's going to be taxed at least a 40% rate. And the death tax and a few other things. Can we just do that? I'll be happy with that to start. And that's pretty much the plan you put out today. Flat, simple, and fair. That's not that hard, Senator. It seems that's a conservative principle. That's a Reagan tax cut to me.
You're exactly right. We can do it, and I think we need to get it done. And I believe we will get tax reform done. I think Republicans understand that if we blow this too, the voters will be so fed up, and if we miss this opportunity, shame on us. And tax reform, I think every Republican wants to see it done. You know, today, as you noted, I gave an address to the Tax Foundation laying out some principles that I think should govern it, a low flat rate, a postcard. Everyone ought to be able to fill out their taxes on a postcard. There is power to bold simplicity. And that's what I've been urging the President and the administration and the Senate is let's focus on jobs and economic growth. And let me tell you one of the most potent tools for jobs and economic growth and tax reform, this was a big part of my speech today, is immediate expensing. What does that mean? That means if you're a farmer and you buy a new tractor, you can immediately deduct that against your taxes. It means if you're a steel worker or an auto worker, that means a new factory can immediately deduct the cost of that factory. If you're a truck driver, it helps you get a new truck. If you're a taxi driver, it helps you get a new taxi or a new Uber car. That produces millions of jobs. It raises wages. It's incredibly pro-growth. And what I'm encouraging for you people, let's focus on Main Street, on jobs, on working class, on the men and women with calluses on their hands.
There's a reason that President Trump won Wisconsin and won Michigan and won Pennsylvania and won Ohio. Let's just start in those 4 states.
Absolutely.
And that's because under Obama, they added 13 million more Americans to the food stamp rolls. Under Obama, 8 million more Americans went in poverty. Lowest labor participation rate since the 1970s and the lowest home ownership rate in 51 years. I would argue all of those things, by the way, they have nothing to do with all of Hillary's excuses, Senator. I don't understand for the life of me. And you have been, you're right. Just keep your promises. What do your colleagues say? Is there not any level of embarrassment after not being able to get Obamacare done? I'd be embarrassed.
Well, there should be a lot of embarrassment. But let me say on Obamacare, I don't believe we're done. I think failure is not an option. What I have told Mitch McConnell, what I've told leadership, what I've told my colleagues, we cannot give up on this. We've got to get it done. This is the central promise Republicans have made for 7 years. If you elect us, we will repeal Obamacare. If we fail to get it done, I think we look like laughingstocks. And millions of people get hurt. And what I think we're closer than many observers think. I think we probably have 45, 46 votes for Obamacare repeal. Now, we're not at 50, but I think we can get there. And, Sean, the way to get there on repealing Obamacare is to focus on lowering premiums. The biggest reason people can't stand Obamacare is it's made premiums skyrocket. They can't afford health insurance. And we lower premiums through having more choices, more competition, more options, putting you, the consumer, in charge of your health care.
All right, Senator, what do you think? Instinctively, I know that we think alike on a lot of issues, and I know that probably the idea that Lindsey Graham has put forward, now the devil's going to be in the details.
Sure.
And I had Mark Meadows on the program yesterday and Dave Bratt on yesterday, and they're saying, yeah, in principle, as conservatives, we'd love the idea. Let states decide. Let them, if they want Obamacare, they can keep their Obamacare. They can keep their plan. They can keep their no doctors, and they can keep their no competition. And if California wants to do that, good for California. And if New York, where I live, unfortunately, they want to do it, I'm stuck. But if other states want more viable alternatives like health savings accounts, and if they believe in these cooperatives like my buddy down in Wichita, Kansas, Dr. Josh Umber of Atlas MD, I'd rather go with the modern solution to medical problems.
Well, I think that Lindsey Graham's proposal could well be part of the solution, and if it brings some of the more moderate members on board, that's a good thing. We've got to get to 50. And as you know, I'm a passionate believer in federalism, sending things to the states, letting the states decide, even if they want to do knuckleheaded things like California and New York. The states should be able to do knuckleheaded things, but give the states the freedom. And I think the key, though, is giving the consumer the freedom. It's why two of the provisions that I've introduced that are included in the current Senate bill are, number one, allowing people to pay health insurance premiums from health savings accounts. You just mentioned health savings accounts, very important. The reason that matters so much is health savings accounts, you're paying pre-tax, which means for millions of Americans, it's an immediate reduction in your effective premiums of 20 to 30%. That's a big deal. But number two is the Consumer Freedom Amendment, which I introduced. It's in the current draft of the Senate bill. Puts you, the consumer, in charge of your health care, says you should choose what health insurance you want for your family, not what the federal government mandates. HHS, the Health and Human Services Administration, scored the Consumer Freedom Amendment. They concluded that it would increase insurance coverage by 2.2 million people, and it would decrease premiums by over $7,000 a year. That's a lot of money. If you're struggling, $7,000 a year, we got to get it done.